Hello, my name is Dr. Frederick Beekle Jr., and I'm a board-certified, fellowship-trained orthopedic joint reconstruction surgeon. I've been in private practice since 2001. I'd like to welcome you here to my New York practice, the Robotic Joint Center. This is located in Manhattan at Park Avenue and 71st Street. Our concierge orthopedic practice is specialized to provide exceptional quality non-surgical and surgical knee care for people with knee pain or disability from arthritis, osteonecrosis, trauma, or sports-related injuries. Starting with the first encounter with our staff on the phone or in the office, we want you to feel comfortable, cared for, at ease, well-informed, and confident in your decision to have us provide your knee care. My surgical focus over the last decade has been minimally invasive and knee-preserving partial knee replacement surgery using the Mako robotic partial knee system. As one of the early adopters and world thought leaders using this technology, I've performed over 1,500 successful robotic partial knee replacements. With the average orthopedic surgeon performing less than 10 partial knees a year, this is several lifetimes of experience I bring to my patients here in New York. I've published and presented on this robotic technology around the world, launched Mako knee and hip programs in over 10 countries, collaborated on the software and hardware development as a consultant, and trained hundreds of surgeons in the US and internationally. The Mako robotic knee system allows me to restore only the damaged knee joint surfaces, maintain all the healthy cartilage surfaces, and retension the functioning ligaments in your knee. Partial knee replacements performed this way provide the most natural feel and function, which is the goal of all joint reconstruction procedures. My partial knee replacements of the medial and lateral compartment are performed as an outpatient using the Mako robotic partial knee system without a tourniquet, with a 2 to 3 inch minimally invasive skin incision that avoids cutting the quadriceps muscle, allowing the patients to walk and go home the same day and recover rapidly to a functional level with minimal pain. When patients come to our private office from around the country or internationally, I listen to each patient's unique knee problem and how it affects their lifestyle. I examine each patient, review their x-rays, review their imaging and medical information, and then provide a clear understanding of the diagnosis and treatment options. Whether you require partial or total knee replacement, knee arthroscopic surgery, or non-surgical treatments to solve your knee problem, or if you're just coming for a second opinion, you'll be confident when you leave our practice that you went to the right place. Our goal is to reduce or eliminate your knee pain and return you to your active lifestyle.